In this video, we'll be reviewing glaucoma medications, prostaglandin analogs, beta-adrenergic blockers, alpha-2 adrenergic agonists, Rho kinase inhibitors, carbonic anhydrase blockers, miotics, and mannitol. For each drug, we will review what it does, some examples, the dangers, which is the side effects we need to be aware of, as well as duties, which is our nursing considerations when giving these medications. Let's get started. The first group of medications for glaucoma is prostaglandin analogs. These are first line, which means they're ordered first for clients with glaucoma. They work by increasing the permeability to the aqueous humor fluid, so allowing that to exit the eye, and decreasing intraocular pressure. Some examples are latanoprost, bimatoprost. If you're watching the video, you can see that they all end in prost. What we need to be concerned about is as nurses, if you look at all of the side effects, they really all have to do with the eye. So for those of you listening, blurred vision, dry eyes, burning and stinging, problems with the conjunctival sac, something we might want to let them know, not that it's necessarily something bad, but it could change the color of their eye, and something they might like is that it can increase the growth of their eyelashes. But as nurses, what we should be considered with is really just monitoring for these local eye side effects. The next category is the beta-adrenergic blocker. These used to be first line before the prostaglandin analogs. We'll still use them occasionally, and we may add this medication if the glaucoma is not well controlled. These work by blocking beta receptors, which is the fight and flight response. It blocks that excitement in the eye, and it allows the eye to drain. It also decreases production of the aqueous fluid. The example is timolol, and if you've studied beta blockers in nursing school, you can always recognize a beta blocker by the ending LOL. The dangers and side effects of this drug is that if it does go systemic, if it does get into that tear duct and get through the body, it causes all the side effects of normal beta blockers, which is lowering blood pressure, bradycardia. It can cause problems in the lungs, causing a bronchospasm, fatigue. It can mask symptoms of hypoglycemia in diabetics. So there's a lot of problems with this drug, and we have to be very careful. We need to make sure as nurses that we really tell the patient to push on their inner canthus so the medication does not get into the system and just stays in the eye. But we also need to be monitoring the blood pressure and the heart rate. We need to make sure not to give this drug to asthmatics, as well as let those diabetics know that they might need to check their blood sugar more often. A third category drug is the alpha-2 adrenergic agonist. These are also usually used as combination therapy when the glaucoma is not well controlled with just one drug. They work very similar to the beta blockers. It's just triggering a different receptor, but it basically does the same thing. Relaxes the eye, lets it drain, and stops the eye from producing too much fluid. Your examples here all end in dine: brimonidine, lopidine. What are we worried about with this one? Local effects, eye dryness, but then because it is very much like a beta blocker, it works in the sympathetic pathway just like the beta blocker did. The side effects are similar: low blood pressure, headache, drowsiness. So as a nurse, we just need to keep our eyes on that as well. And again, tell the patient to push on the inner canthus so the chances of those happening are decreased. This medication is relatively new at the time of the recording of this video. It just came on the market in April of 2018. They're called Rho kinase inhibitors. They work really well by decreasing the Rho kinase enzyme, which is responsible for increasing fluid in the eye. The only side effects we see here is really local eye redness and eye discomfort. The example name is netarsudil. And so as a nurse, just monitor their eye for any local side effects of this drug. Another category is carbonic anhydrase inhibitor. We won't see these being ordered as much. They're really only used for before or after eye surgery or those with really high intraocular pressure. The reason being is that they have a lot of side effects. So some examples are acetazolamide and methazolamide, and the dangers associated with them is the diuretic effect, because that is how they work. They reduce the amount of fluid in the eye. They can cause dry eye locally, but then in the body, dehydration, frequent urination, hypokalemia, even kidney stones. Other side effects are nearsightedness, called myopia, tingling of the fingers, metabolic taste, GI upset, local conjunctivitis, fatigue, impotence even, acidosis, rare but severe Steve Johnson syndrome, aplastic anemia. It can even cause the glaucoma that we're trying to treat, and in particular the dangerous one, closed angle glaucoma, where the patient's eye could actually burst from it filling up with the fluid. So you can see all the dangers, and as a nurse, if you do have a client on this drug, make sure that you monitor fluid and electrolytes. Also, make sure to ask if they're allergic to sulfonamides. This is a sulfa drug. Do not give if they're on another diuretic. Check for their ability to see, if they're having problems seeing, and they might be developing that myopia nearsightedness, and if they already wear glasses, you might need to change their prescription. And just of note, this is one of the glaucoma medications that can also be given PO. Miotics are another group of drugs for glaucoma. These are cholinergic agents. They work by using the parasympathetic tract this time, which can rest the eye, making the pupil smaller. Remember that a rested eye is a small pupil. And this just opens up and allows that drain to drain better. Example is pilocarpine. Some dangers with this drug, some side effects, are dim vision. They can cause headaches because the pupils do go smaller, maybe a little bit of blurred vision, nearsightedness. If the medication does go systemic, the patient can experience a drop in blood pressure and heart rate and some GI disturbances. So as a nurse, make sure to assess whether if they have dim vision or blurred vision, is it affecting their night vision, driving. Monitor their vitals and make sure they press on the inner canthus so the medication does not go systemic. A final category of drug used in glaucoma is an osmotic diuretic mannitol. Mannitol is a hyperosmolar agent, and it pulls fluid out of the eye. It's also used in ICP to pull fluid out of the cerebral area. The example, we already said mannitol. And the danger of mannitol is that we need to know that it's removed by the kidneys. So you always have to check with your patient, make sure they're peeing, make sure they're not anuric, or they don't have any kidney issues. Because if they do, the mannitol will build up in the system and they can experience a lot of complications: hyponatremia, metabolic acidosis, hyperkalemia, edema. So as the nurse, just make sure before you ever give mannitol, ask them if they're going to the bathroom okay, and make sure that their kidneys are functioning. And of course, watch out for any complications after you give this medication. I also wanted to point out some medications that are contraindicated in glaucoma. You want to make sure that you're not giving a medication where if somebody already has glaucoma, it's going to make it worse. And so one of the ones that we see a lot in the options that we have to stay away from is the mydriatic. The mydriatic causes dilation, and you can remember that if you find the D in the word mydriatic, and remember that D stands for dilation. And therefore, if a dilated eye takes up more space in the eye and it kind of blocks that drain in the back, if you just want to think about it that way, and therefore it would increase intraocular pressure. So never give a mydriatic to somebody with glaucoma. The only time we give mydriatics is if we're dilating the eyes for an ophthalmologic exam, like when you go see, the eye doctor, or if somebody is post-surgery for a retinal detachment. That patient needs the mydriatic because increasing the pressure in the eye helps keep that surgical area from cryotherapy or laser therapy. It helps hold it together. So that's the only other time you might see the mydriatic being used. Other drugs to stay away from is anything that could cause a vasoconstriction. So some of your cold and allergy medications, of course your vasopressors can do that. And then for some reason, steroids also cause decreased outflow in the eye, so just be careful with those as well. I hope this helped you with your medications for glaucoma. There is a lot of them, so feel free to listen to this video at least a few times before you kind of maybe really grasp these medications well. And if you want to see more content like this, like our channel, and you can always find us at signstrategies.com.